Here with me on set, MS Now medical contributor Dr. Vin Gupta. What do you make of this spread, and maybe notable after Thanksgiving?
Absolutely. I mean, Chris, I think there's a combination here. We're seeing in the northeast parts of the state the greatest amount of quarantines, especially in school-aged children. And I mean, these numbers, hundreds of kids that we're seeing this in counties that have low vaccine rates relative to what we want to see. We want to see that 92 to 95% benchmark to make sure that we have herd immunity, that we can really stamp out infection before it really becomes an outbreak. We're seeing levels here in Spartanburg, 90%. That's the Meidas for one of these things to really take off in a school, especially given how contagious measles is. So this is concerning. I'd like to say, gosh, we didn't tell or we weren't forecasting this back in the earlier part of the year, but this is expected, likely to get worse.
Well, I mean, the other thing is we're coming up on the holidays. I mean, we did have Thanksgiving, but people are going to be doing a lot of traveling. A lot of little kids are going to be going and seeing grandma and grandpa, presumably, or vice versa. Is this just the start, potentially?
It is, and I think it's important for people to keep in mind what are the symptoms that you should be looking out for. We're not hearing a lot of just anticipatory guidance, if anything, from podiums of power where they should be talking about this. So what are the symptoms there? We have a full screen for all your viewers here, Chris. These are the first 2 to 4 days, and you may look at the symptom list and say, oh gosh, this looks a lot like the flu, and that's the problem here. A lot of these are non-specific symptoms, but time course here matters. So if you're a parent out there, your child develops a high fever, runny nose, and then a few days later, if you look into their mouth and they develop white or bluish tinged spots, Koplik spots, that should really worry you. And then a rash that starts in the face and then progresses down the body. Those are hallmark signs, especially for parents of infants, children that are immunocompromised, or if you're pregnant, you need to seek medical attention, even if you don't feel like you're having, say, shortness of breath or something that would otherwise prompt you to seek medical attention.
The CDC notes more than half of the measles cases, are among children nationally. Given the rise in vaccine skepticism that has been promulgated by RFK Jr. and others, if the vaccination rates continue to trend downward, what does that mean?
Well, I think we're going to see more outbreaks in schools across the country. That's number one. And Chris, we're talking about a 21-day quarantine period. I mean, that's a lot of time out of the classroom. And if we're talking about getting children in school settings and keeping them there with minimal disruptions, that's not the ingredients of success. So one, we're going to see more of this across the country. What I also worry about, talking to pediatric colleagues, is that we've seen since 2008, Chris, a decline in the absolute number of pediatric beds across the country because children's hospitals have closed. They've been transitioned beds, pediatric beds, to adult beds. So we don't have slack in the system to care for somebody with, say, severe measles. And again, for all the parents out there, severe measles doesn't necessarily present as a high fever or a rash necessarily. It could be shortness of breath because pneumonia is a complication of measles. We have less than 30 seconds, but it's worth reminding folks, is the vaccine safe for pretty much any kid? Oh, 100%. Widely studied, extremely safe, something that we don't take anything for granted. We continue to look and assess quality and safety data. No issues from that perspective. And it's not too late. If you're a parent and you're hearing about outbreaks close to you, get your child vaccinated if they're not already vaccinated. Even within a few days, you develop protective antibodies. That's very important to know. Dr. Vin Gupta in studio. It's great to see you in person. Thank you so much.